I have a pain in my butt. Actually, two, if you're going to count this guy.
Hey, I'm Dr. David Crozy, and our purple plaid pants model here is Sherry, and we're going to go over the 9 things that can make a person say, I have a pain in my butt right now. So first off, SI joint dysfunction. That's this big joint between the sacrum and the ilium. If somebody has SI joint dysfunction, it will give them a sharp pain with every step. They say, I feel like I have a hitch in my get along, and it's going to feel worse if they bend backwards, bend back and to the side. We help a lot of people with SI joint dysfunction. Second, facet joint dysfunction. You have 12 facet joints in the low back. If there's swelling in these joints, it can cause pain in the low back, but it can also cause referred pain. So in this picture, you can see that the L2 to S1 joints here can drop pain into that butt region. That also is going to feel worse if the person bends backwards, bends to the side, both in the low back and down in the butt. Sherry, do we help a lot of people with facet joint pain in the butt?
Heck yes, we do.
Heck yeah, it's probably the #1 thing that chiropractors help people with. Now the third thing is sciatica. So the sciatic nerve is a big nerve that comes out right to the side of the tailbone here, and it controls almost all the function and sensation of your entire leg except for the front quadricep region down to the knee. So sciatica is actually more of a symptom. We want to know what's actually pushing on the fibers that make up the sciatic nerve. So the 3 main things, first off, is going to be the swelling in the facet joints or in the SI joint that then pushes on these bigger nerves here. Second is going to be Piriformis Syndrome. So the piriformis muscle is this little muscle deep down in the butt, goes from the tailbone to the outside of the hip, and it crosses right over the sciatic nerve. Can tighten up with too much sitting. Sherry, do we help a lot of people with Piriformis Syndrome?
Heck yes, all the time.
Heck yeah, and some of you out while watching have probably seen the video I made about helping stretch out the piriformis muscle. Now the third thing is disc problems. So the discs are the flexible parts of the spine. They have fibrous outer rings and a softer center. And so if that disc gets injured and some of the soft part gets back to the outside edge, the point that there's an injury there, it will respond like a major bonk on the forehead with a big goose egg. There'll be all this swelling that then pushes on nerves and can cause sciatica, pain, and symptoms down the leg. Now, we help a lot of people who have disc findings, disc bulges, disc herniations on MRI, because even when we see those findings, a lot of times the thing actually pushing on nerves is swelling. So we get the area working better, get rid of the swelling, person's back to normal. There is one symptom that goes with a disc herniation, disc problem that we can't help people with. It's an emergency. That's if a person is losing their bowel or bladder function. So if someone out there, if you're pooping or peeing your pants, you don't go to the chiropractor. You need to go to the ER or urgent care. All right, next up, there is a condition called dead butt syndrome, which is when this gluteus medius muscle deep in here doesn't work right. Now, the reason it doesn't work right usually is because there's pressure on the nerves, and so they end up creating pain in this region. Person would feel this sharp pain if we push right in here, this area here. Very tender. They yelp. Do a yelp for us, Jerry.
Ow!
Yeah, exactly. Person would yank away. Now, the second thing is that if that muscle doesn't work, one of its important jobs is to keep the pelvis level when walking. So if this gluteus medius muscle doesn't work, it drops on that side. And that stresses a bunch of other things over here, giving people different types of pain in the butt. So first off, if you look here, if the gluteus medius muscle here doesn't work, then the IT band and TFL muscle right here try to do the job of the gluteus medius. So that can create IT band syndrome where there's pain on the outside of the hip, or it can tug the kneecap up to the side so people get a bunch of pain in the knee as well. Now second is bursitis, hip bursitis. So there's a small fluid-filled sac on the outside of the hip bone here, and normally it doesn't get rubbed or aggravated. But if the pelvis is tilting with each step, that gets aggravated, it starts to swell up. And that's gonna feel like if Sherry had that going on, she rolled onto her side in bed, it would feel like I was stabbing her with a screwdriver right on the outside of the hip there. So that's hip bursitis. The third thing is a lot of people that have some dead butt syndrome going on will end up with this sharper pain right at the very top of the hamstring here. And that would happen with each step, or when they sit, it just feels like a sharper or a pulling type of pain right there. That's because the tilting in the pelvis is twisting muscles right here at the spot. People call it the sit bone. Its medical term is the ischial tuberosity. All right, the next thing that can cause a pain in the butt is what's called a spondylolisthesis. People call it spondy for short. That's when this piece of bone right here is broken, either as a child or it just doesn't develop properly. And when that bone is broken, then it lets the bone here slide forward. Sometimes it doesn't cause symptoms, but if it does cause symptoms, one of the main ones is a pain down into the butt. It would be like a pulling or a squeezing sensation on one or both sides, also down into the hamstrings. Now, people with spondylolisthesis causing butt or hamstring pain, one of the things that we'll see is that usually they can bend way far forward without any problem. They can palm the floor. Sometimes that even gives them some relief, but they aren't able to bend backward very far because that bone is slid forward and out of line. All right, the last cause of pain in the butt we're going to discuss is the coccyx. So at the very bottom of your tailbone, as far south as you can go, we have the little coccyx bone, and it can get injured, it can get out of line. When that happens, every time the person sits down, it's going to feel like they're being stabbed with an ice pick or they're sitting on a hot coal. Now, if there's a mild case of this going on, we can do some adjustments in around the low back and SI joints and often have that feel better. But if this is a 10 out of 10 pain, there is a very helpful treatment for it, but it requires going inside the body. So yeah, what you're thinking about is what I mean. We don't do that here. Fortunate news though, there are a couple physical therapists here in town, doctors of physical therapy, that have done special training to do internal works to help the coccyx. So there's one over at Des Moines University, there's a couple over at Breathe Physical Therapy. If you want the exact names, reach out to me by message, we'll get you that information. So, just to be clear, none of what I've gone over here is a substitute for a good exam. But the take-home message here is that unless you're losing bowel or bladder function, or you feel like you're sitting on an ice pick every time you sit down, all the rest of these causes of I have a pain in the butt, we can help here at Compass Chiropractic. And you don't have to just take my word for it. I mean, look us up on Google. You'll see so many great feedback from our patients that have come in and had great results with problems, low back, neck, and in the butt. And so if you've been putting up with the pain in the butt, I want to invite you to click the link below, learn about the special offer we have for you, and let's find out what's causing you to say, I have a pain in my butt.